Good morning once again. Thanks to all of you for coming this morning to HUD to hear the preliminary findings from the HUD study on PHA's efforts to serve persons experiencing homelessness. My name is Milan Ozdenek. I'm the Deputy Assistant Secretary for the Office of Public Housing and Vouchers. You'll see that not only do we have a PowerPoint today that outlines the findings from the study, but also CLAFA was generous enough to provide extra copies of their recently public released Housing Authority's Essential Partners in Ending Homelessness. We thank CLAFA for putting together such a thoughtful and thorough document that can serve as a model for best practices for housing authorities in the future. We also would like to note that the U.S. Interagency Council on Homelessness, USICH, has recently released a guidebook on their website where PHAs and advocates can access information on the different types of topics relating to homelessness, including barrier mitigation and other strategies to help serve homeless families. We have provided a 2-page handout that is a resource page for that guidebook. We'd like to acknowledge USICH has also joined us today. I think we're here. Barb here? Barb Poppy, thank you very much, is the director for the USICH and joins us with our staff. Thank you. There has been a remarkable response to this event from not only Washington, D.C., but from our local field offices and advocates around the country. As such, the event today will be taped and posted to the HUD website for future viewing. Before I turn it over to the Deputy Secretary, I want to thank all of you again for being here. It's not often that such a diverse group of advocates, HUD employees, and interest groups from all over the country to be here today, to be together, and in fact in this room. But it's fitting for the subject matter. Ending homelessness is the work of not only one, but many, and not just one person, but all of us. Without further ado, I'd like to turn it over to the Deputy Secretary, Maurice Jones.
Good morning, and thank you. It's nice to be with you on Friday the 13th. This morning I got up and it was early, it was dark, and I went outside and my truck wasn't where it usually is. And I panicked, right? And I was like, oh my God, Friday the 13th. Well, I just had parked it a little ways around. That's what superstition will do for you, right? But that's not what we're here for this morning. But you are here at the height of the shopping season and Friday the 13th, so I know you could be other places, and I want to thank you for being with us. The Secretary sends his apologies. You got the second string, but I'm gonna try to do the best I can. I want to give you some statistics to start off the morning. And the statistics are the following. On a single night in January of this year, 610,000 plus people were homeless in this country. Most of them, 65%, were living in emergency shelters or transitional housing programs, and the rest, 35%, were living in unsheltered locations. Of those homeless persons, 610,000 plus, 222,000 plus were homeless families. 36% of all homeless people, 50% of all homeless people in sheltered locations. There were almost 47,000 unaccompanied homeless children on this single night in January of 2013. Most of them, 87%, almost 41,000, were youth between the ages of 18 and 24. The remainder, about 13%, a little over 6,000, were children under the age of 18. Now, this administration believes that no one should be without a place to call home. And in 2010, this administration made a commitment to end homelessness, outlined in a document that we called Opening Doors, the Federal Strategic Plan to End Homelessness. It is arguably the most ambitious plan in this country's history to put the nation on a path toward ending homelessness. About 19 federal agencies are involved in this collective effort to end homelessness within a decade. Since launching Opening Doors, chronic homelessness has dropped by 16%. Homelessness among families has declined by 8%. And homelessness among veterans has fallen by a really impressive 24%. These are really remarkable trends in any season, but even more remarkable given that our country is healing from the greatest recession that it has experienced since the Great Depression. In communities all across the country, and this is the key point and why we are here this morning, where local public housing authorities have demonstrated leadership on moving towards the goal of preventing and ending homelessness, guess what? We have seen significant progress. I want to thank the PHAs for the work that they're doing in this area, and I want to also stress what I just said, which is that we know that a game changer in this journey is the work that PHAs are doing all across the country. We know that we cannot end homelessness within a decade without the impressive efforts of our PHAs. We know the work is not done and cannot be done without your leadership and support. We recognize that effective and efficient use of mainstream resources like the public housing and voucher programs are perhaps more important than ever, given the current economic and budgetary environment. And while the economy is recovering, families continue to struggle, especially those who qualify for the public housing and Housing Choice Voucher program. We hope this morning that the study findings will assist PHAs and communities to continue to make informed decisions about resources and to help forge partnerships at the federal, state, and local level to make ending homelessness a reality for all. So again, thank you for what you're doing. I look forward to studying these findings with you. And now, I want to turn the microphone over to by far the most elegantly dressed person up here, our Assistant Secretary, Sandy Henriquez. Thank you very much for being with us.
Thank you, Mr. Deputy Secretary. Good morning. I want to thank you as well for taking time in your busy schedules to join us here today. As the Deputy has said and Milan has mentioned as well, together, all of us in this room and those of us who are not here are really doing some amazing and new and great things here to really end homelessness in this country. These are truly exciting times here at HUD, but the times are also trying, especially for many of our neighbors in our communities across this nation who are facing a cold winter without shelter. Like President Obama and Secretary Donovan and Deputy Secretary Jones and all of us, I strongly believe that no one should be without a safe, stable place to call home. It's the foundation upon which we all build our lives. It's what we take for granted. And I know that all of you here today share this belief, and that ending homelessness must become a reality for every single man, woman, and child in our nation. It's a collective responsibility that only through partnership can we accomplish. As the Assistant Secretary for Public and Indian Housing and as a former public housing executive director, I do know firsthand the importance of HUD's work and for us to be able to work hand in glove with public housing agencies and homeless providers to end homelessness. I recall my days at the Boston Housing Authority, where addressing the city's homelessness issue was a top priority of mine and the mayor's, and of all the dedicated BHA staff, as well as the mayor's office, the continuum of care, and dozens of community providers. We participated annually in our homeless counts. They were always invariably the coldest days in December, and we would go out at about 9:30 at night and be on the streets sometimes till 2 and 3 o'clock in the morning. But I want to tell you why, and if you've not done a homeless count, you have to do one. You have to get your staffs to do them, to connect the dots of the real work that happens on the ground. I want to give you 2 examples of why this work is so important to me personally. One of the first point counts I did with the mayor, mayor goes out, cameras are with him, the press is with him. Some of us peel off and go down different hallways and alleyways and subway tunnels and all of that stuff. But the mayor, there was a picture of the mayor bending down to talk to a gentleman who was out on a very cold December night. And that picture made the front page of the Boston Globe above the fold. So you all know that anything above the fold is major league follow-on story. It just so happens that that photo with this unidentified man in the picture with the mayor was seen in Worcester, which is probably a 40-minute drive west of Boston, where his family, who had not seen this man for 15 years, did not know his whereabouts, saw him, made contact with the city, reunited with their family member, and that man went on to live a much better, sheltered life. Real story, why it's important. The second story I want to share with you, also true story. Another point in time count we were doing with the mayor, and at the corner, a block away from the Boston Housing Authority headquarters, there's a building that houses a CVS drugstore. And huddled in the corner one December night was a young woman, 7 months pregnant. She had never had prenatal care, in fact, had never been to the doctor, and was drug addicted. And the mayor shooed away all of the cameras. We tried to lead them away so that he had some quiet time to talk with her. And he talked her into going into shelter that night. She committed to him that she would get the prenatal care she needed for the child she was carrying. She would try very hard to get sober and get on with her life. So fast forward about 8 months, 9 months later, I happened to be on the board of a hospital in the city of Boston at the time, and that board wanted to come and have a conversation with the mayor about some expansion it was planning. And so I put it together. We were on the mayor's calendar. I accompanied folks in. They did the meeting for 45 minutes with the mayor, and then we left. We sat in the lobby of the mayor's lobby of his office because we're going to do a little debrief. But one of the developers who was going to lead the expansion for the hospital stayed in the mayor's office. And so I got a little impatient and I went in to get him. And he was talking to the mayor, and he had two 2x3 wallet-sized photos in color. One was of a woman, it looked like a graduation picture almost. Shirt, open-collared shirt, string of pearls, hair nicely done, a little makeup. It happened to be, no joke, the woman the mayor had talked with months before that he talked to go into shelter. The second picture was of an adorable baby girl. That's the child the woman had. The woman had relapsed and had not stayed sober, but the daughter, the little picture of this little adorable baby girl, was now the adopted daughter of the developer. And he was telling the mayor that story. It is real. This is why this is important. This is why you do the work you do, we do the work, and we do it together to make a difference in people's lives. Whether you know it or not, it makes a difference in people's lives. I'm sure all of you in this room have stories like mine. If you've not done a homeless count, do one. I urge everyone in this room today to look at the CLAFA publication, to take the study findings seriously, and to help us do something that this country should have end once and for all, that no man, woman, or child in the United States of America is homeless again. Thank you very much. And I'd now like to introduce and bring to the podium my colleague in crime, if you will. We work collectively, our staffs work together on this issue very seriously and live and breathe this every day. Acting Assistant Secretary for Community and Planning and Development, Mark Johnston. Thank you.
Good morning. It is a real pleasure to be here as part of this announcement. I've been looking forward to this day to learn more about the final results since this study began, which has been some time. When I have been reflecting on the great reductions that this country is seeing on homelessness, on veteran, chronic, and now family homelessness, it really is in large part because of extensive collaboration. I've seen this certainly at the individual level, where individual homeless people that I've been able to meet with and try to help a little bit, it requires a whole lot of collaboration for a single person to come off the streets in terms of outreach workers, different housing resources, case management, and then long-term support to help them. And that's really why we're seeing reductions in homelessness that were just released recently through the point-in-time count. And this collaboration happens on a bunch of levels. So the first one really is, from my perspective, that there is a lot of collaboration that non-federal employees probably don't appreciate that's going on in an incredibly intensive way between agencies such as HUD, the U.S. Interagency Council on Homelessness, and the VA. As I reflect just on this week, there have been a number of different meetings that we've been holding with those three agencies together, thinking through these very kinds of issues. Collaboration within HUD, and you've heard some of that already described. I really do consider Sandy a great partner in this. Her wonderful staff, Danielle and Lori, for instance, are just great in moving this ball forward in figuring out how we can use mainstream resources to continue the progress in reducing homelessness. This study, frankly, is an example of this collaboration within HUD, where the Office of Community Planning and Development, which I oversee, funded the study, PD&R oversaw it, and PIH has been helping throughout the process to help design, develop, and then hopefully we'll see great implementation by PHAs as they learn more about this, as we at HUD, in particular PH, will be giving guidance and suggestions on ways that we can approach it. And then finally, but certainly not unimportantly at all, is the actual collaboration on the ground, which really makes it all happen. All sorts of different stakeholders. And I look at a program like HUD-VASH as an example about how all of these different collaborators actually have to be part of something to make it happen. So on HUD-VASH at the federal level, you've got Public and Indian Housing actually having those vouchers and handing them off to public housing agencies. But we do it in very thoughtful, strategic ways because Public and Indian Housing collaborates closely with CPD, which has the data as to where these homeless veterans are in the country. We work very closely with the VA and collaboratively allocate where those vouchers go. It's not just some random assignment or some issuance by a formula, but an intentional targeting of limited resources through these three different entities. And then HUD-VASH really takes place on the ground where you've got outreach workers from the VA, either contracted or direct employees that are connecting with the public housing agency. There are just many, many steps that take place for a single person to be housed in HUD-VASH or frankly any other housing intervention, and it ultimately makes a huge difference. We're also looking at different ways as we go forward on what are the clients we have, homeless clients that don't need the intensive services that are now available through permanent supportive housing because they're frankly very expensive. And those are some of the things we're looking at as we look at housing choice vouchers and public housing, especially as we're looking to achieve the goal of ending family homelessness by 2020. In the 2013-2014 Continuum of Care NOFA that was just barely released, we're talking about proactive engagement of local public housing agencies to help solve this problem of homelessness. This could include, for instance, continuums and PHAs discussing how extra or new homeless preferences could be employed to reduce homelessness, or adopting strategies to assess current homeless employees that might be, homeless persons, who might be in a CPD homeless program but really need permanent housing, for instance, through the Section 8 program. The report discussed today is particularly important given the really tough budget challenges that we're all facing. With limited resources and frankly cuts that we've seen recently and may well see in the future, we've got to be even more strategic on how we can use these very precious dollars. The findings of this report, from my perspective, will help inform us and communities about how we can better use these limited resources. Just in closing, I wanted to say how grateful the Office of Community Planning and Development is, CPD, for its partnership with PIH and PDNR on this study. And congratulations to PDNR and APT for, I think, an outstanding study that's going to inform the country. Thank you very much. I'll turn it back to Milan.
Thank you, Mark. You may have noticed that over the past several months, PIH, with the assistance of CPD and USICH, has developed several pieces of guidance and webinars on the issue of homelessness and how PHAs can serve their homeless populations. The goal is to provide PHAs with as much information as possible to make informed decisions with their limited resources. We know that across the country, PHAs are working under extraordinary financial constraints to serve families. We cannot and should not ignore the lack of adequate funding that may hamper these efforts. The public housing program, which serves homeless families, the administration is committed to providing sufficient operating subsidy to continue to serve the 1.1 million families. In the HCV program, we serve 2.2 million families, but the administration remains committed to ensuring that adequate administrative fees are provided to housing authorities to continue to serve those populations and more. We're also committed to the administrative fee study that PDNR is engaged in currently to ensure that PHAs are fairly compensated for the work that they do. Yet, despite the tight budget climate, one only has to look through the CLAPA publication to see the extraordinary results that PHA's efforts are garnering at the local level. The study on PHA efforts to serve the homeless is just one way HUD is trying to better understand the various approaches and best practices so that we might be able to better coordinate a more unified response to an issue that affects each and every one of our communities. The idea for this study really was developed from what so many of you already know. To meet the goal of ending homelessness, targeted homeless assistance programs simply do not have the capacity to provide housing assistance to all the households experiencing homelessness. The public housing and voucher programs would need to be part of that solution. The study was truly a departmental effort, with CPD funding the study, PDNR designing the study and managing the work, and a large consortium of PHA staff, particularly my staff, helping to guide the study every step of the way. It was also a true partner effort, considering the fact that over 80% of the PHAs that were asked to respond to the survey did, in fact. That's 3,200 out of some 4,000 PHAs. It's very commendable, given all the work that we asked PHAs to do. We hope that the preliminary research findings presented today provide all of us in the collective a launching pad for further dialogue and partnership with PHAs, community advocates, and philanthropic organizations. With that, I'll turn it over to APT, Jill and Eliza. Thank you very much.
Thank you, Milan. Eliza Keene and I are delighted to be here to present the results of this study of PHA's efforts to serve people experiencing homelessness. We want to thank Ann Fletcher of PD&R for being such a wonderful project officer, and the staff of CPD and PIH and the Interagency Council on Homelessness, who played a very large role in supporting this study, including helping develop the survey instruments. We spent long hours in conference rooms here in the HUD building, really going over question by question, and the study is a much stronger study as a result of that intensive collaborative effort with HUD staff. I want to add my thanks to Milan's, to the PHAs that gave us such a tremendous response to this data collection effort. So the goals of the study were to examine the extent to which the 4,000 PHAs across the country are making efforts to serve people experiencing homelessness. The emphasis on this study is the mainstream Housing Choice Voucher and public housing programs. PHAs also sometimes administer homeless assistance programs. They administer special purpose vouchers such as VASH. But this study was really commissioned to try to figure out, to create kind of a baseline measure of the extent to which PHAs are making efforts to use their mainstream and much larger Housing Choice Voucher and public housing programs as part of the effort to end homelessness. Now, as everybody in the room knows, I'm sure, public housing and housing vouchers are waiting list programs. There's not enough housing assistance for everybody who needs it. Mark and Milan have both mentioned the resource constraints that these programs live under, and therefore PHAs have, and a majority of them use, the authority to rank order their waiting lists, to create preferences or priorities for households with certain types of characteristics, which can include homelessness. The preference systems that are permitted to PHAs and administered by PHAs can be pretty complex. They can be layers of preferences with different rank orderings. Several household characteristics can be merged into a single preference category with equal weight. The different programs, public housing, housing choice vouchers, project-based vouchers to the extent that PHAs use that authority, all of these can have different preference systems, and they often do. So we collected the data for this study in two different ways. One was a web-based survey of the almost 4,000 PHAs across the country. Milan mentioned the 80% response rate. In terms of the numbers of program units, 86% of all of the voucher units administered across the country were represented by the PHAs that chose to respond to the web survey. The questions on that survey were very much focused on how the preference systems worked. We also asked some questions about PHA staff perceptions of barriers that people experience when trying to use the mainstream housing assistance programs. Then following the web survey, we chose small samples of PHAs, 75 that had strong efforts based on the web survey, and about 50 without strong efforts, and had open-ended telephone conversations with those PHAs to learn a lot more about the details of the ways in which efforts by PHAs to serve homeless people are working, and also for those that we discovered weren't making such efforts, what were some of the constraints that PHAs wanted to tell us about that meant that they had not, in fact, made the kind of efforts we're talking about. Well, the efforts, and I probably should stop back and should say, in case it's not been clear, what we don't do in this study is count the number or percent of people served by the voucher or public housing programs that are homeless. It simply isn't possible to do that based on the data that are available. The administrative data form that all PHAs have to submit for each household, the 50058, does have a question on whether the household admitted to assistance is homeless, but that question doesn't seem to be working, and a sort of a minor or secondary objective of the study was to try to find out why. And what we found out is that some PHAs actually have that data element auto-filled as no. And others may misinterpret what it means. So there's still some work to be done to actually measure the outcome of these efforts, but this study instead focused on measuring what those efforts that PHAs are making are. We looked at 3 different types of efforts, and one is general preferences. Now, a general preference orders the PHA's waiting list so that people with certain characteristics, households with certain characteristics, are chosen to be admitted to public housing or receive a housing voucher before other types of households. And these are unlimited preferences. Everybody in the highest preference category goes ahead of everybody in the next highest preference category. Then there's something called a limited preference. That's the technical term. These are often thought of as set-asides. Technically, they're not set-asides in that the vouchers, for example, are not held aside until a homeless family or individual comes along. But to the extent that those families do come along, they get preference for a fixed number of units of housing assistance. So limited preferences or set-asides. We measured in the web survey the extent to which PHAs are doing that. And then we also defined a third kind of effort, which is PHAs responded to one of the questions saying that they either modified their usual screening rules or they modified other program rules or administrative procedures to make it easier for people who are experiencing homelessness to use the mainstream programs. And Eliza is going to talk in a few minutes about what some of those barriers are and how PHAs and their partners are trying to overcome them. So the bottom line of the study is that 24% of all of the PHAs are making at least one of these 3 efforts, at least one of these 3 types of efforts. And importantly, those PHAs control more than half of all of assisted housing units. Now, I should say something more about what we mean by a general preference for people experiencing homelessness. 32% of all PHAs mention homelessness as part of their system of general preferences, but only 10% have what we defined in the study as a strong general preference. That is to say, a preference that puts people at the top of the waiting list so that they have a real chance of having priority for receiving housing assistance. Often we concluded that only 10% of the PHAs with about 10% of the units have such strong general preferences in which homeless people really go to the top. More often, the preference for homelessness is submerged into a larger category, and those larger categories can include people with high rent burdens, current residents of the jurisdiction, and other categories that I've listed here, some of which are very large, so that having a preference that's equal to a preference for households with severe rent burdens really is not a strong enough preference that we considered that to count. So turning now to set-asides and modifying screening or other program rules, we found that 9% of all PHAs told us that they had set-asides, explicit numerical set-asides in either vouchers or public housing. These PHAs, however, have 36% of all of the assisted housing units, so they tend to be the larger PHAs. I'll talk more about that. It also tends to be, to some extent, the larger PHAs that told us on the web survey that they modify screening. We took a look at the overlap and discovered that many PHAs do one of these three things, but not all of them, or not even two of them. You can see from this Venn diagram that the overlap between those with strong, well, I didn't actually put in the numbers, but the overlap numbers are pretty small. Most of the PHAs either have strong general preferences or limited preferences, or they make screening modifications. The biggest overlap is for those that have set-asides and also told us that they modify program rules. About PHAs with about 26% of all of the assisted housing inventories do both of those things. So that's probably the most common and the most and the most powerful of these PHA efforts. Now, as I've already said, larger PHAs are much more likely than smaller PHAs to have set-asides or to modify their program rules. Smaller PHAs, interestingly, are just as likely to have strong general preferences, that is to say, preferences that put people at the top of the waiting list. By small, I mean PHAs that control 500 units or less. And you know, kind of scratching our heads about what this may be, we speculate that smaller PHAs are often in rural or suburban areas. They have homeless populations, but not huge homeless populations. So these PHAs may be more comfortable with the idea that homeless households get absolute priority. Larger PHAs, big city metropolitan PHAs, may be more reluctant to have a general preference that gives absolute priority to an unlimited number of homeless households out of a concern that their housing voucher program, for example, could be exclusively a program for homeless people. PHAs with only public housing, and there are quite a lot of PHAs that only own or operate one or two public housing developments, are much less likely than PHAs that have voucher programs as well as public housing or exclusively voucher programs to make strong efforts to serve homeless households. We also looked at, we asked on the web survey, do you project-based vouchers? And found that 14% of those with voucher programs say that they project-base some of their vouchers. Those PHAs are particularly likely to have set-asides. On the other hand, we also looked, it's not on the slide, for these set-asides, to what extent are these tenant-based vouchers and to what extent are they project-based vouchers. It turns out it's not the case that set-asides are overwhelmingly project-based vouchers. About half of all of the PHAs that do set-asides just do so on the basis of tenant-based vouchers, about a quarter do both, and about a quarter only do project-based vouchers for these numerical set-asides. Other PHA characteristics, which I've alluded to already, but metro area PHAs are much more likely to make strong efforts, but not general preferences, strong efforts by set-asides and modification of program rules. Not surprisingly, in some sense, PHAs with large numbers of homeless households based on the point-in-time counts are much more likely to make efforts to serve homeless households than those that don't have large numbers of homeless people. Now, we speculated at the start of the study that it could be that PHAs that have lots of people on their waiting lists, which are often the same PHAs that have large homeless populations in their jurisdictions might be reluctant to make efforts to serve homeless households because they have such a high demand for housing assistance overall. We tested that and we found out that it's not true. We were able, on the basis of questions that we asked on the survey, to categorize PHAs into high, moderate, or low demand PHAs, and we learned that those that have closed waiting lists or waiting lists that it would take almost 8 years to clear, which is what we defined as a high-demand PHA, were actually more likely to also make efforts to serve homeless people, despite the high overall demand for this very unfortunately limited housing assistance resource. PHA participation in the homeless services system helps explain efforts. Being part of the COC makes a difference, particularly for set-asides or modifying screening. Interestingly, administering programs targeted to homeless households, such as VASH or Shelter Plus Care, has a positive effect on efforts to use vouchers or public housing. Instead, rather than saying, well, I've already done my bit because I'm administering the VASH program, those PHAs also are more likely to be making efforts in their regular vouchers. Similarly, administering special purpose vouchers like non-elderly disabled or family reunification that are not targeted to homeless people but to other special needs people seem to have a positive effect on PHA's willingness to also serve special needs populations who are homeless through their voucher and public housing programs. So in the follow-up survey, we asked why PHAs don't participate in the continuum of care, planning and resource allocation efforts, and 75% do not. We discovered in the follow-up survey that it was very often the smaller PHAs that only have a couple of public housing developments. Maybe they're public housing developments for seniors. Said that that's why they don't, or they sometimes said, well, I'm in this small town and the COC may cover me in theory, but I'm hundreds of miles away from the COC. I don't even know who they are. And a few PHAs said, we really do have very limited resources, long waiting lists. Our waiting lists are closed. We don't want to get involved with the COC and open those waiting lists to a high priority group that would bump the people currently on the list. But it wasn't that many PHAs who said that. And in fact, a lot of the PHAs that we talked to said, well, I do plan to get involved with the COC, I just haven't done it yet. Now I'm going to turn the podium over to Eliza Keene, who's going to talk more about barriers that PHAs perceive gets in the way of their efforts to serve homeless households. And also, she's going to talk about the kinds of partnership arrangements that PHAs have with organizations that serve homeless people, non-housing organizations that largely serve homeless people, and exactly what those partnerships look like, what the partners do.
Thanks, Jill. So as Jill mentioned, now we're going to move on to the topic of barriers. And to learn more about the barriers that people experiencing homelessness may face when applying for, securing, or maintaining housing assistance, both the web and the follow-up telephone survey asked questions of PHAs about their perceptions of those barriers. In this slide, we show the top 5 reasons that were identified by PHAs in response. You can see the most commonly cited barrier is that homeless applicants with no fixed address are often removed from the waiting list, with 46% of PHAs agreeing with that. In the follow-up telephone surveys, we asked PHAs to elaborate further on what they had identified in the web survey as barriers. And for this one, PHAs mentioned that people experiencing homelessness are transient and sometimes use shelter address or a temporary address on their PHA application. And then when it comes time to contact the household, if their name comes to the top of the waiting list, they're unable to find them and they're not able to offer the assistance. On the other hand, some PHAs reported on efforts to make it easier for those households to update their contact information, such as taking changes by phone or by email. And some offer liberal reinstatement policies if households are removed from the waiting list. Second most commonly cited barrier is that people experiencing homelessness don't have the necessary eligibility documentation, both as required by the program and for documentation of any preference that they might be eligible for. And then fewer PHAs, between 11 and 16%, cited other barriers, as you can see here. Households needing assistance in finding units, high rates of turnover, and the high costs associated with assisting homeless households. So we wanted to look at these barriers identified by the size of the PHA. This slide includes those top 5 barriers that we just discussed, but shows them as divided amongst sort of the top 3 different size categories of PHAs. As you can see, barriers for homeless households are reported most frequently by larger PHAs, those with 5,000 or more units. Those are the green column in each of the clusters. And Jill mentioned earlier in the presentation, larger PHAs are more likely to make efforts to serve people experiencing homelessness. So these barriers are likely based on their experiences working with homeless households. The exception to this is that more small PHAs stated that they're not able to serve extremely low-income households, including those who are homeless. The red column in the right side cluster, those are showing PHAs with fewer than 500 units. This is likely because of higher costs. Larger PHAs have more ability to absorb additional costs than smaller PHAs with smaller operating budgets. So what about the PHA relationships with other community organizations providing services to homeless people? In the web-based survey, we asked about the partnership arrangements that PHAs establish with local organizations. 30% of PHAs reported that they had a formal arrangement with a local organization, and this was defined as one that's guided by an MOU or an MOA. And 11% reported that they had 3 or more such formal partnerships. So we see here a larger share of PHAs, 30%, compared to the 24% that Jill mentioned early on that are making strong efforts to serve homeless households. So this gives us an indication that even those PHAs that are not making strong efforts to serve homeless households, some are entering into partnerships with local organizations that provide services to homeless households and those with special needs. So that's a good indication. Next, we'll explore how these partnerships help mitigate the barriers that we've just talked about. What are PHAs and their partners doing to serve people experiencing homelessness? In both data collection efforts, we asked PHAs to describe their partnerships in more detail. Partnerships focus on providing assistance at several stages of the process of assisting homeless households to access housing: during outreach, eligibility screening and verification of homelessness, providing housing through different types of programs, and providing assistance locating housing, and promoting housing retention. We'll talk about each of these sort of in turn here. Now, in terms of outreach, homeless people are often already being served by partner agencies, receiving case management services or other services such as mental and social services or assistance with completing the PHA application. People experiencing homelessness that are referred from partner organizations often receive preference for housing assistance. One example, a PHA reported that households referred by several of their partner organizations receive 50 priority points that moves those households higher on the agency's waiting list. And during the telephone interviews, we learned that referrals sometimes happen the other way, with PHA staff referring people experiencing homelessness to local organizations for immediate or temporary assistance while they're on the waiting list for housing assistance. And one of the primary functions of partnerships that we found between PHAs and local organizations is to assist with the eligibility screening and homeless verification process for households. We learned that partner organizations conduct pre-screening with homeless households, making sure the applicant is indeed eligible for housing assistance before sending them to the PHA to sort of formally apply. And partner organizations may also help determine if the household is a good candidate for any special programs that a PHA may operate. Partner organizations also often assist homeless households in gathering the necessary documentation that is part of completing an application. You can imagine it can be difficult for people experiencing homelessness to have all the necessary paperwork, birth certificates, social security cards, documentation of income or benefits. So we heard about a lot of partner organizations that assist in this role. The partner organization can also provide to the Housing Authority a verification of the homelessness status of the homeless household, which many PHAs require to provide that preference. And we learned that PHA staff often meet with staff at provider agencies to help them understand the PHA programs and the policies and procedures for housing assistance. In all cases, PHA staff continue to perform housing quality standards inspections, rent reasonableness assessments, and criminal background checks. The next area that partners work with PHAs is in placement in housing. And in the phone survey, we heard that PHAs said they liked vouchers to serve homeless households. They noted that vouchers are easier to pair with services and that their service provider partners often request vouchers for their clients. But some PHAs also talked about using public housing to serve homeless households. The waiting list for this housing resource can sometimes be shorter, and for homeless households who have poor rental or credit histories, the PHA then can still assist that family because the PHA is the landlord. One PHA provided an example. They set aside 34 units of public housing in 3 developments for chronically homeless adults who were referred from a local partner emergency shelter provider. And the provider offers supportive services, and the program receives funding from a local foundation to support caseworkers and other related housing expenses for those households, security deposits, paying rent arrears. PHAs also use project-based vouchers to serve homeless households. And using this resource, we learned that PHAs often target specific subpopulations of homeless households, such as chronically homeless, veterans, victims of domestic violence. Project-based vouchers may be spread out across a PHA jurisdiction or clustered in one building. And PHAs find these project-based vouchers effective for serving homeless households because they allow for collaboration with a community partner. And the Housing Authority can leverage other resources, CDBG, ESG, to provide supportive services. Partner organizations may also manage the project-based building and may refer clients to the project's waiting list. As part of our data collection, we also talked with a good number of PHAs who are part of the Moving to Work demonstration. MTW agencies noted that the flexibility allowed them due to their block grant funding gave them the ability to use funding in a variety of ways that they wouldn't be able to do without such flexibility, such as supporting staff or services that are specifically targeted towards homeless applicants and formerly homeless residents. MTW agencies also describe using sponsor basing, and this is a method for those who you may not be familiar, this is a method that allows a partner agency to hold a master lease to vouchers or units. It's a practice that's not allowed under regular program rules, but with MTW authority, these agencies are allowed to do it. And I guess it's considered controversial by some. But the MTW agencies who described their use of it noted that it really enabled them to pair housing assistance with supportive services offered by local organizations. So it was a good example of how they worked with a partner. Partners also provide housing search assistance to help homeless households use vouchers in private market housing. These partners can leverage existing relationships with landlords to help get homeless households into appropriate housing, and can help with establishing the relationship between the tenant and the property owner. Partners can also provide other housing assistance, including security deposits, utility deposits, other efforts that can help facilitate the transition of homeless households into permanent housing, and furniture, appliances, that such a thing. And a final area where partners offer services is in the promotion of housing retention, keeping the formerly homeless households in their permanent housing situation. 2/3 of PHAs with efforts to help people experiencing homelessness have a partner organization providing these types of services. PHAs described case management as the most common service, kind of broadly described. But they indicated, various PHAs indicated during the telephone interviews that the ability to pair supportive services, such as through case management, with housing assistance is key to successfully serving this population and promoting retention of housing. Other services include food assistance, employment and vocational training, financial planning, life and soft skills, mental and physical health care, and substance abuse services. PHAs also mentioned that they like having another entity, another resource, another person that they can contact if the household shows evidence of struggling in maintaining their housing situation. So those are the partner roles that we learned about. We wanted to mention, that around the same time that our data collection efforts were coming to an end, HUD released a notice that provided guidance on housing individuals and families experiencing homelessness through the mainstream housing programs. And we were pleased and relieved to see that a lot of the information and strategies that HUD outlined in that guidance were largely confirmed by what we had learned in the study. In addition to guidance, written guidance, PHAs mentioned that they would also like to have more opportunities for training and further understanding of some of these policies. So finally, we'd like to close with some thoughts on the possible considerations for HUD that emerge from the study. We offer a number of suggestions, and some of these may be more possible than others, given our current environment. But we think that HUD should encourage large PHAs to create limited preferences, and so that they can, and those that are already doing limited preferences, that they do more of the same. We'd also like to see use of the guidance, the notice that I just mentioned, to encourage more PHAs to implement some of these policies, especially modification of screening, using their discretionary authority to do that. We'd also like to see the encouragement of smaller PHAs to create strong general preferences, and promotion of participation in the COC, and alternatively have COCs involve PHAs that are in their jurisdiction in their planning process. And finally, I have to put a plug in for requesting additional funding, but requesting additional funding for special purpose vouchers. This would allow more PHAs to implement those programs, building on the effect that Jill discussed, that administering these programs has on efforts to serve those experiencing homelessness. So with that, thought, we close our part of the presentation, and I guess there's going to be some Q&A for us and others.
Thank you very much. Thank you very much, Jill and Eliza, for all of your hard work. It's very informative. We can't wait to see the report. So we're going to open it up for questions. If anyone has a question, we have mics here. Yes.
On this chart of the barriers on page 7, those 5, were they actually written down as an option they could select? I mean, were they prompts, or did you just sort of open the question and they had to respond with what their barrier was?
It was a list that but they could answer any number of them. So they were just told to answer, put down as many as they wanted to.
Yes.
I'm Linda Kaufman from the 100,000 Homes campaign. 2 questions. One, really simple. It says here, not for distribution. Can I assume on the PowerPoint, is this for distribution now? Can we share this with our colleagues? And okay, well, you guys talk among yourselves, and and I'll ask an easier question. The easier question is, one of the things that I've been doing a lot of thinking about is how we triage and get the right people among the folks who are homeless to actually get the housing assistance. And I don't see anything in here about how we might be triaging folks who show up asking for housing. And I wonder if that showed up in any of your conversations with the housing authorities.
We did ask on the web survey if PHAs had preferences for homeless households. Was it a particular type? Was it people experiencing chronic homelessness? Was it homeless veterans? And so forth? And so we do have some information in the report on that. We didn't really, in the follow-up interviews, get into triage systems, assessment and placement into particular types of permanent supportive housing. That really went beyond what we were able to talk about in these hour-long telephone interviews. But great question.
Just ask the question, just respond to the question about the not-for-distribution. It is indeed not-for-distribution. The report hasn't yet been cleared to the department, so while we don't expect them to begin to negotiate, just very quickly. So we just ask that sometimes it takes a long time for things to come out the other end of the pipeline, so we wanted to make sure that everyone had a chance to see what was coming. But we would ask that the slide not be.
When will the study be produced?
The target date is end of January, early February, for the final, of course, be out.
Catherine Greenspan,
Welcome back.
retiree, formerly with the Housing Choice Voucher and PIH and Family Self-Sufficiency Program. I was wondering whether any of your sites, if you had any idea, if they offered family self-sufficiency to any of the formerly homeless families, since that is actually often a great way of helping retention and stabilizing families and also connecting them with local resources.
I don't think that came. Am I on now? Again. Oh, there it is. I don't, hi Catherine, I don't think that came up in any of the telephone interviews. I mean, we did, not the FSS program per se. People certainly told us, PHAs told us about working with partners that provided FSS-like assistance, FSS-like case management, but not as far as we heard within the structure of the Family Self-Sufficiency Program itself.
Okay, no more questions? Well, I want to thank you again for being here. I just want to run through some next steps for you as we move into 2014. My staff will continue to work with US ICH and CPD to further analyze the study and assess the barriers and how we can devise strategies to overcome barriers. PIH and CPD will work together on how to continue to provide incentives for the COCs to partner with PHAs in future NOFAs and vice versa. In the next few months, PIH and PD&R will be posting the data from the survey on our website in hopefully a usable and useful format for PHAs. Once the study findings are complete, the clearance process, the report will be available sometime in early February, hopefully. We continue to talk to our industry partners, both in this room and outside, on how to increase collaboration between local partners and PHAs. And finally, HUD and USICH will continue to provide targeted technical assistance to our PHAs in the local communities to strengthen their contributions to end homelessness. So with that, I want to thank all of you for being here today and have a safe and happy holiday.